Is a name considered to be protected health information? A name, whether a full name, first name, or last name, is considered protected health information, or PHI, under HIPAA if it can be used to identify an individual in conjunction with their health information. The privacy rule defines PHI as any information that can be used to identify a person and relates to their past, present, or future physical or mental health, the provision of healthcare, or payment for healthcare services. According to the privacy rule, there are 18 identifiers that, when combined with health information, can be considered PHI. A patient's name is one of these identifiers. Others include dates related to the individual, contact information, and identification numbers. When a name is used in isolation without any connection to health information, it is not considered PHI. However, when a name is combined with health information or data that can be traced back to an individual's health, it becomes PHI and falls under the protection of the HIPAA privacy rule. When is it a HIPAA violation to email a patient's name? It is essential to understand the specific circumstances surrounding the transmission of patient names via email to determine if it constitutes a HIPAA violation. A violation may occur in the following instances: unauthorized recipients. The email contains PHI, such as a patient's name, and is sent to an unauthorized individual or entity. This may include healthcare employees without a legitimate need to access the information, third parties without a business associate agreement, or BAA, and external entities not involved in the patient's care. The email is unencrypted. The email is sent unencrypted and it contains PHI. HIPAA requires PHI transmitted electronically be protected with appropriate safeguards such as encryption when transmitted over the internet. And finally, an unsecure email system. The email is sent using a personal email account or an email system that does not meet HIPAA security standards. Should all healthcare emails containing names be encrypted? In general, it's highly recommended to encrypt all emails containing PHI, like names, to minimize the risk of unauthorized access or disclosure. Encryption is particularly crucial when emails are sent to recipients outside the organization, such as referrals to specialists, consultations with external providers, or communications with third-party vendors. Emails are sent over public or unsecured Wi-Fi networks, where interception is more likely. And finally, the email content contains highly sensitive information, such as diagnoses, treatment plans, or financial data. While encryption is strongly recommended for all emails containing PHI, there may be specific situations in which it is not strictly necessary. These scenarios might include the following: internal email communication within a secure network where adequate access controls and firewalls are in place to protect against unauthorized access; communication with patients who have provided written consent to receive unencrypted emails, acknowledging and accepting the associated risks. Remember, even in situations where encryption may not be required, it's still a good idea to use encryption to protect PHI and reduce the risk of HIPAA violations. By encrypting emails containing PHI, healthcare organizations can help ensure the privacy and security of sensitive patient information.